Hello, everyone. I want to share with you the knowledge and experience with the 7.5 French Puissant suction scope, which is a new scope recently launched. My name is Professor Bhaskar Somani. I work in Southampton. So just to go through the mechanics of the scope, the design is very intuitive, and there is a new port seal and a suction device, which is different from the previous 7.5 French small scope. The suction valve allows active suction by pressing on it through the operator. So in this video, you can see that you've got the suction port. This is the irrigation port, the adapter, the suction port, which is there, and it is actively controlled by pressing on the suction. And the deflection is at the back. And once you press it, you can have suction, which is through the same port as the irrigation, but it reverses the flow. Now, going forward, what are the main advantages of such a system with the integrated suction? Apart from being portable, good sterility, which is there with all single-use scopes, the visual quality is very good. You can record them. And with the suction system, you can aspirate and keep the irrigation temperature and pressure low. So here you are, you can see how we are doing it. It's easy to maneuver. You can see it's button activated, which is easy and intuitive to hold. And when you do that, you can see active suction happening. You don't have to have a separate irrigation system for this. It uses the same irrigation system, and it gives a negative pressure to collect the fluid and some debris. So in terms of the clinical application, I'll share with you a few cases. The first case was a large 2.1 centimeter renal stone with recurrent urinary tract infections in a 48-year-old female. I used this because I wanted to keep the risk of post-op infection and potential sepsis low, and to allow the stone to be done as quickly as possible, keeping the intrarenal pressure low and minimize operating time. So here you can see the stone in question. As I am lasering the stone, I'm sucking it at the same time, and I'm not having the same snow globe effect that you find where the vision is disturbed. So as I'm doing it, it is constantly getting sucked. I think that the important thing also is we are not worried about the temperature here as much as otherwise you would be on continuous laser activation. So you can see I'm carrying on without worrying about the temperature side of things. It is allowing a good visibility, and you keep going on. And the dusting is obviously with the laser, but all that dust is continuously getting aspirated. So there are multiple advantages of such a system where you aspirate the dust and small tiny particles and fragments. Here you can see I'm repositioning them in the upper pool, and then you can use your pop dusting method where I use a 0.5 to 0.8 joules of energy and 30 to 40 hertz in terms of frequency. And once you have done your pop dusting, you will see very fine dust that you create. And although you can't aspirate large fragments, but you can aspirate dust at the same time, enough to give you some for stone analysis. So that is, again, a very good aspect. You don't have to always, if it's very fine dust particles, you can have some stone debris for analysis. The vision is good throughout the procedure, and at the end, as with any small 7.5 Puissant ureteroscope. And as you come out, you will see that I'm aspirating, and at the end, you will see the fragments getting aspirated, which is quite nice. You can see here, as I come out, the fragments will get aspirated. And that is quite a nice feature here. You can see that, right? So again, it's a good scope. So the next case is a 36-year-old male patient with iatrogenic mid-ureteric stenosis referred from another hospital with an 8 mm renal stone in the lower pole. And again, the challenge here was to overcome the stricture. It was a small caliber scope was needed, which was flexible, and I had good control, and again, minimized the operative time. So you can see here that it is quite narrow. The guide wire has just gone through. So I first of all do an endopallotomy with a laser using a setting of 1 joule and 10 hertz or 8 to 10 hertz. So it's a contained cut. You can see I've done that. Once you do it, enough to get a small scope in. And remember, this is a 7.5, so getting a bigger scope would have been more difficult. Once you do that, on the inside, there's a lot of debris, as with any sort of hydronephrotic system. And with the integrated suction, you can clear out the debris quite nicely. Once the debris is cleared up and you're not having to aspirate with a syringe, you're just doing it with the suction button on the scope, which makes it quite intuitive actually to use. And you can see now once the debris is cleared, the vision is a little bit better. You can get the laser in. Once the laser is in, then you can start lasering the stone. Now, with suction, the stone is also coming towards you, which is again an advantage, I think, because normally in dilated systems, the stone is away from you. But when you're sucking it, the stone intuitively is coming towards you. And that can also help in difficult cases, which is something that perhaps would be useful in some cases. And here you can see the stone can actively be moved with the help of suction. So you can see I've got the suction and I'm getting the stone to move to a different location just by pressing on it. Now, just to share one more case with you, this was a 12 millimeter right lower pole stone, previous unsuccessful with lithotripsy, and a very tortuous pelvic junction. So again, I wanted to use a small scope with this to overcome the tight PUJ and to have a good control again, keep the pressure low and minimize operating time. So here you can see the PUJ is tortuous and you can see it's not again very big. When you try and negotiate, you can get through, and then the stone is in the lower pole. Again, you start lasering. Similar to the first case, you can keep aspirating it. And with aspiration, you can see that the effect of snow globe is minimized. You're not having to start and stop. You're not worried about the temperature so much, and you're not worried about the pressure so much, and the stone is coming towards you. So again, all these advantages in this difficult low pole was put to use with the suction ureteroscope. And this is something I think going forward can be really helpful in difficult cases, horseshoe kidney, anatomical issues. Of course, you can use it for any case, an standard case with large stone, etc. But if you had to balance between using it in every case, I think probably the use will be very, very good in between 30 and 50%. I certainly have started using it for all stones, and especially when the trainee is doing it. With the suction, you can really keep the visibility quite good, which is again a good feature of this. You do need extra irrigation, so you do need to have more irrigation than what you would normally use. But I think as you can see here, again, the pop dusting effect is working well. I'm not having to stop and start. I'm continuously lasering without worrying about the temperature. So these things would really help you push the boundaries of stone treatment. And also they would help you increase the safety because of the issue of intrarenal pressure and sepsis, etc., because you will be safer in doing these procedures without worrying about this, and of course minimizing time, which is again a critical factor when you're doing difficult cases where we know that the operative time is directly linked to complications, and this can again help you with this. So again, you can see that continuous effect of lasering without having to stop and start, and the view is maintained all throughout because you're maintaining a balance between the irrigation and suction. And bearing in mind the suction is in your control. You don't have to oversuck it to make the system collapse. You just do enough to let it keep going, to keep the visibility good. And again, this is something that I think over time you will understand it better, but you can see it's a good view all throughout. So my first impression of this 7.5 single-use flexible ureteroscope with suction, I think apart from all the advantage of a single-use small disposable scope, the suctioning allows clearance of debris, improves the visual quality, and also you can retrieve smaller fragments and dust through the operative channel. Thank you so much, and I hope you find the video useful and you can try this scope, and hopefully we'll share some videos together. Thank you.